So, Doctora, thank you for agreeing to help us learn more about telemedicine. So, off the top of your mind, what are your top concerns doing telemedicine?
Thank you for your question. So my top three concerns for doing telemedicine during the time of the pandemic is number one, the lack of legislation. Because the Medical Act of 1959 somehow says we have to physically examine the patient. So good that the DOH and the National Privacy Commission has issued a memorandum circular that we can do telemedicine now. Second
Waiver,
would be
parang waiver. Yeah, go ahead, sorry.
Second would be the internet connection. As you know, there is the digital divide, and that is even more pronounced now. If you have a good internet connection, then you can probably do teleconsultation with your doctor. But what if you don't? Then automatically that's inequity.
Mm-hmm.
Number three, it's hard to establish rapport with the new patient via telemedicine. So personally, I've only been seeing follow-up patients, patients that I've previously seen in the clinic and now cannot see because my clinic is closed. I'm seeing them via telemedicine.
Mm-hmm. And how are you? How are your patients paying you? Is that not a concern?
That's a concern now. During the early part of the pandemic, I was actually giving free consultations. But as
Oh,
the
thank you.
pandemic as the pandemic and the quarantine extended, so I now had to ask my patients to pay. And what's peculiar is they now have to pay before the consultation, which is not the usual model. At the clinic, they see me and then they pay afterwards. So we've had to find ways for them to do it online, like bank transfer, for example. Some of my colleagues use like GCash or PayMaya or other online payment platforms.
Oh, great, great. So, with all these problems, would you be able to share with us some of your tips and tricks to work around to overcome all these problems?
So telemedicine for the Philippines will have to use some low bandwidth solutions. Although there will be limitations, there are some cases where you can get away with not doing a video, but doing an audio consultation only. Some will have to be doing it chat or text based, of
Mm-hmm.
course, with the proper security precautions.
Mm-hmm.
And then we do have to educate our patients on how to present themselves while they're doing the teleconsultation. I was thinking that maybe in the future we can have telepresenter training,
Ah, yeah.
meaning someone, maybe a nurse or a barangay health worker, can be with the patient and can carry out a doctor's orders. Like, can you touch the patient's skin? Is it warm or cold, etc.? At least they're
Mm.
able to describe it well for the physician to make a decision about what needs to be done for the patient. And then we're trying to get our medical societies to come out with guidelines to help both the patients and the physician transition to telemedicine, because there are extra procedures like asking for informed consent, for
Mm-hmm.
example, and choosing which patients are suitable for teleconsultation. Because definitely emergencies, we can't manage them via teleconsultation. They have to go physically to the emergency room.
I see. And when I was talking to you earlier, you did mention some of the mas maseselang klasing virtual physical exams. You know, this might be. Can you say tell us more about it?
So for example, a cardiologist might want to see the chest to check the heart. And can you imagine having to disrobe in front of a camera so that the cardiologist on the other end of the camera can see your chest? So we really have to select what kind of
Ah.
physical exam maneuvers are feasible and are not feasible to do via a teleconsultation.
And so I'd hate to be an OB-GYN at at this time and age. I wonder how many of my patients would want to be virtually examined. And
So
also
it's
yeah,
really not
sorry.
going to be, that's not going to be a happening. They really have to.
And also some doctors are starting to use some tools like stethoscope. You did mention some doctors doing this.
Yes. So the primary barrier against that would be the cost of the device.
Mm-hmm.
Who will pay for it? The doctor or the patient? And how will we get it to the patient's side if they're at home? Some people are considering using the devices inside clinics, because now we still have to have social distancing. So at a distance, I can hear what the heart sounds are without having to physically go near the patient to put my stethoscope on the chest.
I see. You know, you've told me a lot already, and I'm sure our loyal followers would appreciate all these insights that you've shared with us. Thank you again, Doctora, for these insights and your willingness to share your knowledge with us. Yeah.
Thank you, Wilson.
Yeah. Let me stop the recording. How do you stop the recording?